Welcome to The Pursuit of Health, the podcast of America's free choice of medicine. I'm your host, Reinier Schuur. Joining me back on the show is Dr. Colleen Smith to continue our discussion of rethinking American healthcare from a philosophically informed and pro-freedom perspective. Welcome back to the show.
Thanks, Ray. I'm happy to be here.
So the big topic in healthcare today is, of course, the affordability of healthcare. It's in the news. A lot of the political discussions about the ACA, subsidies extensions are about affordability, and the affordability of healthcare is a big issue. And it's something that we've touched on in prior episodes. And I thought for this episode, what would be valuable for our audience is to dig in a little deeper and provide them with a more principled view on how to think about the topic of the affordability of healthcare. And perhaps a good question to start us off with is to simply ask, why is framing the debate about the affordability of healthcare only in terms of affordability not really sufficient for capturing what it's all about?
Well, I think to really answer that question, we have to think about what is meant by affordability and what the various players in the healthcare space mean when they talk about affordability. So, if we talk about liberals, for example, they think that healthcare should be something that everyone can afford at all levels. Maybe it doesn't even matter what the service is that you're getting, whether it's a transplant or an x-ray, you should be able to afford it. And then maybe when we go to conservatives, they think more that we should make sure that poor people are able to get healthcare, but they're more okay with this sort of variation in prices. But I think when people are talking about affordability right now, they're really hitting on what we're kind of seeing as healthcare is not even something that wealthy people or upper middle class people are able to afford. And even basic screening and primary care, and even just like a common specialist visit, is becoming out of the range of what upper middle class people can easily afford. And so I think that's why we're really starting to see this focus on affordability as kind of the touchstone or the touch phrase, and like what's wrong with healthcare today, because even people who everyone thinks should be able to afford healthcare can't afford it.
Right. And I think one way to capture the view that's out there is that the unaffordability of healthcare is not simply an economic issue. In many ways, people experience it as a certain kind of injustice, right? That we should be able to afford healthcare, and it's unjust that we can't. And I think what that points to is people have a particular view, not just of that healthcare should be affordable, but of a particular kind of healthcare, right? Like where it's not simply uh, the sticker price, but what you're actually getting for it. And I think the deeper view there is that, well, we have a certain kind of right to a particular kind of healthcare where we have a particular kind of relationship with the people providing it. And we've covered that in previous episodes as well. And we'll get more into it, but the basic view is that people think that they have a right to healthcare where their relationship with their doctor is one where neither party truly considers the cost of healthcare. And if that's the case, then we can't really find our way out of this debate about how we can afford healthcare without contending with the view of healthcare that we're willing to pay for. And so that's one of the main things that we would like to do in this episodes today is to contend with those different kinds of views. And so a natural place to go next would be to ask, what is the dominant kind of view of what right to healthcare that we do have?
Today, I think the dominant kind of view, to kind of give one answer to that question, and I think we're seeing this view a lot from people like Bernie Sanders and Elizabeth Warren, but even I think it's pretty mainstream, is the view that healthcare is a basic human right, that every human should have access not just to affordable healthcare, but to healthcare.
Yeah, so what I think is interesting is that when people think about the view that you have a right to healthcare, they automatically think about this more political view that the government has to provide you healthcare, and that's always in terms of what the patient is owed. Um, but if you actually look at the history of medicine, that's a pretty recent view. Um, a much uh, more fundamental and older view is this view that what we have a right to in healthcare is a particular kind of relationship between doctors and patients, and where it's not just the patients that has a right to a particular kind of healthcare, but doctors do. And what that kind of healthcare is what we've discussed before, is the idea that we have a right to the patient-doctor relationship in such a way that is free from market forces, free from considerations of price, right? Where the moral ideal is that when I walk into my doctor's office, neither me nor my doctor really have to think about what things cost. And of course, things cost something. So at the end of the day, somewhere down the line, that has to be considered. But there's this kind of view that if we put a price on what goes on in the doctor's office itself, somehow corrupts medicine. And then that itself is seen as a kind of injustice.
But at some point, we do have to contend with cost. And in a sense, I think this is a naive view. It both assumes that there's only ever one choice in anything that we choose in healthcare, that there's one correct option or plan for care for any patient. And that's just, it's naive and it's wrong. In healthcare, we have a variety of choices. We have many ways to go about doing almost anything. And so to leave out consideration of cost is to do a disservice to patients and doctors. And and really to kind of overlook one key element of all the variety of risk benefit analyses and cost analyses that you do when you decide on a treatment plan.
Yeah, and we'll definitely get more into what's wrong with this view, but I think for now, one thing that's worth noting about this view is that it's not simply a view that's shared by progressives, right? This is a view of what you have a right to in healthcare that many conservatives share, right? Like they won't call it a human right or a political right or a legal right, but they might think of it as a kind of a moral right. Like you have a moral right to a doctor-patient relationship that is free from market forces. And they might think that the way to provide that is not through the government, but then the government still has to manage the market in such a way to make that happen.
So, given that across the spectrum, there's this deep sense in medicine that medical decisions should be made without consideration of monetary price. How does affordability fit into this view of medicine?
I mean, I think the first thing to notice is that affordability is not the primary issue. The primary issue is protecting the doctor and patient relationship from market forces at all costs. There might be some thought given to it, given that if things aren't affordable, then, well, people can't access healthcare. But it's also notable that what happens as a consequence of this view is that if doctors and patients don't consider the cost of things, then you don't have this basic kind of mindset and mentality that you see in other areas of the market, where both producers and consumers think about what things are worth buying and selling, what things are worth producing. And if you don't have that basic mindset, well, there's really no reward for thinking of something more affordable, right? And we talked about this in previous episodes as well. Under the insurance-based model for paying for most of healthcare, a doctor in many ways is not rewarded for example, withholding care when it might be better for a patient. And so it's a sacrifice sometimes for doctors not to recommend something, even though they know it's the best thing for the patient. Whereas under different models, something like that could be monetized, where the withholding of care when it's appropriate should be rewarded. But that's not the case. And lo and behold, what happens when most of health insurance pays for most of healthcare in the name of protecting the doctor-patient relationship from market forces? healthcare becomes unaffordable. That's what happened after both private health insurance was expanded in the 1940s and 50s. It's what happened after the passage of Medicare and Medicaid. The cost of healthcare exploded. And then you had insurers who have to impose controls, but those controls don't really get at the fundamental issue, which is allowing for this kind of mindset that actually makes things affordable. And you just see the same approach that the way that we make things affordable now is through subsidies and regulations, but that hasn't really worked.
Well, I think patients also have the similar mindset, the sense that doctors should really be doing everything regardless of the cost. I mean, so, I have an example of this that's happened to me as an emergency medicine doctor. Um, I had a patient once who had hit their head on a cabinet and came to the emergency department because they were concerned that they could, have a concussion, have bleeding in their brain. I evaluated the patient. I did a complete neurologic exam. In my kind of preparation for seeing patients like this in my career, I've read a multitude of studies that have assessed when is it safe to avoid doing a CT scan of the head, when is a CT scan of the head helpful or not in determining whether someone has a concussion. In fact, you can't even see a concussion, a mild concussion on a CT scan of the head. It's a clinical diagnosis. So after evaluating this patient, listening to his history of present illness, as we call it, doing a complete neurologic exam. I spent probably 10 minutes talking to him about how he might have a concussion, why I didn't think he needed a CT scan of his head, how he could protect his brain for the next few weeks from additional damage. I didn't do a CT scan of his head. I recommended against a costly test. I saw him ahead of many people to try to expedite his visit in the emergency department. So he ended up only spending probably 45 minutes there, which is, if you've ever been to an emergency department lately, is a really quick emergency visit. Because of that, he hadn't been registered yet. So I told him I was going to get his discharge papers and he should check in at the front desk to register before he left. He laughed at me and said, "Wait, if I register, then they'll bill me. And you want me to pay for this?" I mean, like, yes, I can take that as insulting. On the other hand, it's really just evidence of the fact that he didn't see me saving him time and me saving him the money of having a head CT as a benefit. He saw that as, I'm trying to like save the hospital money but still get paid and not do a test for him that would otherwise be helpful in diagnosing something. I think he maybe doesn't know as a patient that there's also a risk of radiation from a head CT. He's not thinking about balancing all of these risks and benefits, including time and cost. And I think, right, we've kind of created this situation where people either feel like they're being swindled by their doctors, or they, as that patient did, they don't recognize that time and effort and training and money went into me being able to confidently decide that he didn't need a head CT, or they think that they should be getting all of the tests, not recognizing that that isn't an efficient way to practice medicine.
Yeah, and I think what's interesting about that is that it shows the kind of corrupting effects that thinking of healthcare as a right can have um, for the patient, right? They think that because it's a right, it's something like, well, it's just this thing that you give me, right? And it's like, why can't you give it to me? And you're trying to communicate that, well, I've actually thought about it, and it's not like some slop that I put down in your bowl, right? It's I've thought about you and your situation and what you actually need, and this is my recommendation. But they're like, no, give me my slop. And then they feel like they're insulted when you don't give it to them. And then, yeah, it's like, what do you say to that? And then yeah, like indeed like it's like you're like left speechless. But I think that that's definitely one of the main things that we have to communicate to our audience and other people, that viewing healthcare as a right belittles the value of medicine. Medicine is a product of the mind, not just the doctor, but also the patient, in thinking about what's important for them and how to achieve it. And that's not something that some system can just plop down for you out of context. It requires work for both people, and it requires freedom. And a lot of people think that this view that receiving healthcare without consideration of cost is just, right? Because their view is that if you don't have that, then well, doctors are going to just think about making money and like screw you over. But is that actually true? Like, what's the just thing to have here in healthcare?
So with your question, we have to say what justice is. Justice isn't everyone gets the exact healthcare that they want. Justice isn't healthcare is free for everybody, right? Because that's not just to the doctors who have put in all of this time and effort and deserve to get some reward for the value that they're providing. Like justice is actually an exchange of value for value. And that's true in healthcare too. And so, I think there's this question of, do we have a right to healthcare? And you and I mean, not to put too fine a point on it, we're both saying no, you don't have a human right to healthcare. And in fact, by saying that you have a human right to healthcare, you're being unjust.
Right, you're claiming the mind, time, and effort of the people that produce healthcare. And not only that, you're chaining each other in your relationship between doctors and patients, right? So we we have an ideal of like what the proper relationship between doctors and patients is, and I think a major lesson to be learned from the view that well that relationships should be free of considerations of cost is that first of all it's an impossible view because things have costs, and it leads to doctors and patients not being free to actually interact. And you see this in all sorts of healthcare systems that are socialized, that patients in many cases can't pay their doctor for certain things because it's against the law, like they'd have to go outside of the system, right? And that's unjust, right? If a patient is willing to pay for something, a doctor should be able to receive it and more importantly be rewarded for their hard work. And I think what's also important to point out about this view of what's just in healthcare, of what we do have a right to in healthcare, is freedom to trade with doctors in such a way that does consider costs. Not only is that a just view, that's also what leads to its affordability, right? Because that rewards doctors and patients of thinking of new and better ways and more affordable ways to achieve health.
It also allows doctors and patients to consider the nuances, like personal nuances in health, in their healthcare. I mean, I like, not to make this too long, but I have so many examples of patients either deciding to do something or against doing something for not just monetary costs, but costs to their time and their life. Um, you know, Patients deciding to take on more healthcare risk because of some value that taking on that risk will help them pursue, versus deciding not to take on that health risk because of some value that doing, like that making some medical decision will work against them in their life. I just and to not include money in that equation, I think is just naive. And really that isn't fair to patients or doctors.
And I think to bring this back to the topic of the unaffordability of health care as it is being discussed today, to take our view seriously would mean that you would think about it quite differently. If what you have a right to in healthcare is a relationship that does not consider the cost of healthcare, well, yeah, then first of all, it becomes unaffordable and it's unjust. But from my perspective, It's unjust, and we can't afford this view. This view is bankrupting us financially and morally in our relationships between patients and doctors. And so to not only make things more affordable in healthcare, but also more just, which is the right perspective, then we need to be free in order to consider costs, which the current system does not allow and does not reward.
So, Ray, what would that look like?
Long term, it would mean deregulating healthcare and allowing for models to finance healthcare that rewards doctors for creating value, right? Which the current insurance-based model does not do. It insulates doctors and patients from the considerations of costs directly. And that's something that we really need to change. And we need to have a kind of cultural change there too, where it becomes not only normal, but empowering for doctors and patients to talk about what things cost. And I think that's a good place to end for now. And with that, I would like to thank my audience and till next time.
Till next time.
To stay up to date on our newest episodes, subscribe to our show from whatever podcast platform you are listening from. To support our show and Americans for Free Choice in Medicine, you can make a financial contribution at www.afcm.org/donate. Thank you for listening.